So next up on the agenda is Kristin Valentino. So Kristin has Shaw Center for Children and Families in like everything she does. So she's the Shaw Center for Children and Families professor and also the director of the Shaw Center for Children and Families here at Notre Dame. You heard Vice President Bernhard mention the Shaw Center this morning, but I'll just give a little bit on Kristin's specific work on that. And her research focuses on the transactional nature through which children's interactions with their family, community, and culture can shape the course of development. So Kristin's going to talk today about some of her research, I presume, some of the things that the center does. So take it away, Kristin.
Great. Thanks so much for having me. Just to double check, can you all see my slides in presenter view?
Yes, thank you.
Okay, great. So thanks for having me. Again, I'm going to share mostly some work happening at the Shaw Center, and I'll give a couple of examples from my research specifically. So just to introduce you to the Shaw Center for Children and Families, we are a center that is mainly research-based, focused on, bringing people together to conduct innovative research to understand and support healthy development across the lifespan. So we're mainly a research facility. However, we also, in everything we do, are incorporating teaching, both at the undergraduate and graduate level, and also thinking about service to the community. And in fact, we also run or operate a small child and adolescent therapy and assessment clinic out of the Shaw Center as well. And so in our work, we have 4 primary research themes. The first is focused on adversity. The second is thinking about relationships and ways that we can support healthy development. Both of these relate to our understanding of well-being. And then finally, all 3 of these things are related to how we can take our basic science and think about translating that into intervention and translating that into practice. So when we think about adversity, I'm sure many of you are familiar with adverse childhood experiences, or ACEs. I've listed a variety of adverse childhood experiences here, and we can also think about adversity happening in our environments, in the broader community. So it's not just at the individual level, but it could be at multiple levels of ecology where adversity is occurring. And of course, these are all structural and social determinants of child health and well-being. So to just give you a flavor of some of the work happening at the Shaw Center now, the things that I have outlined in boxes are, forms of adversity that are incorporated in various aspects of our research currently. And much of what our research focuses on is trying to understand, how is it that these forms of adversity affect child health and development, or family health and development. And one of the key things that we're interested in, especially through our basic research designs or our longitudinal studies, are trying to identify mediating mechanisms. So processes that can help us understand how is it that early adversity links to these poor health and developmental outcomes. And we're also interested in thinking about moderating mechanisms. So maybe in some contexts, the link between adversity and health and development is exacerbated. And in other contexts, kids are protected. So we want to understand about those as well. And once we have those mediating and moderating mechanisms identified, then that helps us inform and develop treatment programs, because we can target those programs at the mechanisms that we've identified in our prior work, and then move those into, randomized clinical trials to evaluate those programs. So to give you a brief example from my own research, I tend to focus quite a bit on the experience of childhood maltreatment, which includes abuse and neglect. And we know that childhood maltreatment is related to a variety of negative health outcomes, right? So it's adversely associated with children's cognitive development, their emotional development, their biological development, including their stress physiology. And I was very interested in trying to identify some processes that helped us understand how, especially at the family level. And so my work has identified that some specific aspects of maternal support, in particular how moms talk with young preschool age children about their past emotional experiences, is really critical and helps us explain in many ways how maltreatment is related to these poor outcomes. So through poor maternal support, we can understand a variety of outcomes. And so once I understood that, actually with the help of a Indiana CTSI PDT grant, I developed an intervention program aimed at teaching maltreating mothers how to improve in this key parenting skill. That research had some really promising effects on, both our ability to teach moms these skills and on some immediate positive outcomes for kids. And so we were able to move that to a randomized clinical trial funded by NICHD. And we found a number of positive outcomes. So in terms of the direct effects of the intervention, we see improvement in child memory, in child emotion knowledge, so getting at these cognitive and emotional domains. And of course, the thing that we were trying to change, which was maternal support, was also directly changed and improved following the intervention. And then we were also interested in, then downstream, do we see the things that we were expecting to see? And as we follow these families over time, 6 and 12 months after completing the intervention, we do see that there are indirect effects of the intervention through maternal support on a variety of child outcomes, including their memory, their emotion regulation, their stress physiology, and their emotional adjustment. And so we're really, really interested in continuing to follow these families and understand how this translates, hopefully, to reduced risk for psychopathology, and also looking at other biological indicators of stress, such as inflammation and metabolic risk. So, going back to the phases of research, here we see, the standard going from basic mechanistic research all the way through to dissemination, trials and effectiveness research. And I just wanted to give a couple of examples of Shaw Center research at these various levels currently. So at the level of basic and mechanistic research, one big project that we are recently, we just began, it's launching now, is focused on trying to understand the mediators and moderators of the link between experiences of discrimination and mental health among the Latinx community. Another big project that we're working on is continuing to follow those families from my randomized clinical trial, thinking about what are the pathways linking that early adversity and potentially now this experimental manipulation of maternal support to understanding children's behavioral and physical health now that they are in middle childhood and approaching pre-adolescence. Another one of my colleagues, the managing director of the Shaw Center, Jen Lefevre, is conducting some research on incarcerated mothers and their children who are in prison nurseries. And some upcoming work that we've planned is to continue to think about youth suicide and experiences of discrimination among maltreating families. Moving to efficacy trials. So these are all studies that have been informed by prior longitudinal research. We have one program called the Pregnant Moms Empowerment Program. This randomized clinical trials for moms who've been, or pregnant women, I should say, who are exposed to IPV. This is led by Laura Miller-Graf. Another major project is aimed at an intervention designed for families who have a child with a neurodevelopmental disability and also a typically developing sibling. And the idea behind this intervention is to improve family communication and improve constructive conflict resolution strategies to improve outcomes, both for the child with the disability and for the child, the sibling who does not have a disability in the family. We have another project that's focused on maternal and paternal sensitivity training with infants and thinking about potentially the added benefits of also including an intervention that is focused on improving constructive conflict resolution within couples. And then the last project I wanted to mention on the efficacy trial stage is also a combination project that's planned between the intervention that I mentioned, which is delivered during early childhood, the reminiscing and motion training, with Laura Miller-Graf's prevention program that is aimed at women during pregnancy to think about the possible benefits of this dual generation approach, trying to understand if we intervene at two critical moments in the developmental life course of these families, if we might see some added benefits there. And then the last stage that I want to highlight is effectiveness trials. So Mark Cummings is the PI on the Family Communication Project, and this is something that he's already had a number of randomized clinical trials demonstrating the efficacy of these projects, which is usually demonstrated in lab. And so the goal of these effectiveness trials then is to partner with other agencies to see how well these things work in the community. So this is a new project just launching now. And, I'm looking towards trying to also do the same with my reminiscing and emotion training project, disseminating that into the community. So in summary, our research here at the Shaw Center addresses adversity and relationships to enhance child development and well-being. Over the past few years, we've served about 1,300 families facing various forms of adversity. We have a really collaborative team and strong community partnerships, but we're always eager to engage a wider group of communities and learn more from collaborative partners outside of Notre Dame. And so we'd be eager to hear from others and welcome some new collaborative opportunities. And I just wanted to acknowledge our major funders and our Shaw Center and staff, our families who participated in this research, and some of our primary community partners. Thank you.
Thanks so much, Kristin. I really appreciate hearing about your work and the Shaw Center's work, and it's all great. And so we don't have any questions in the chat, but we do have a couple of minutes. So I'm going to ask for your, your take for the Shaw Center on the best ways and maybe just how you're doing subject or participant recruitment into your studies.
During the pandemic, are you specifically?
Yeah, just, maybe not, let's not focus on the pandemic, right? But maybe we could just say in general, like, South Bend's not a huge community. I mean, it's reasonably large. So how are you making all of these studies that you just presented work when we're not, we're not as big as the Indianapolis area and things like that. So how are you doing that here in South Bend?
Sure. I mean, I think one of the things that we really focus a lot on is building strong community partnerships and, strong relationships with a number of agencies and nonprofits in town. And so we even have a staff position here at the Shaw Center. It's a part-time community liaison, and that job is about forging those partnerships. And then when it comes time for us to recruit for a new study, we are able to, be introduced through somebody who has already established relationship with some of these agencies, and I think that goes a long way. And we've really met a lot of really open folks and agencies who are also really interested in this work, and they see the potential, like really direct benefits potentially for the clients that they're also serving. And so, for example, the Department of Child Services has been a huge partner for my research in terms of finding some lower income women and families. We've partnered with Head Start and the local WIC office. And so I think that, and also a number of us are involved with on the boards of local agencies and things like that. And I think all of those community connections really make a big difference in trying to identify participants and spread the message about potential opportunities to become involved.
Great. Thank you very much. And how much, I don't know that everybody knows that the Center for Children and Families has, I'm going to call it a satellite office. I don't know what you guys refer to it, but in Fort Wayne. And so we've reached out a bit beyond the South Bend area into Fort Wayne. And how does that impact the work that you and your colleagues at the center are doing?
Yeah, we do have a satellite office out in the Fort Wayne area, and that was really helpful and has been helpful for, expanding the reach of our studies. And, so in particular, I think the study that benefited the most from that location was the study trying to recruit families who have a child with a neurodevelopmental disability and a sibling who's in a particular age range. And so increasing our geographic reach, I think, was really useful. Although I do have to say, a benefit of the pandemic has been learning how to do everything and translate all of these things virtually. And I feel like we're way less restricted geographically at this point. So that project actually is fully virtual and telehealth. And so at this point, they could recruit participants from really anywhere, which is kind of exciting.
Right. Great. I guess we have to try to find the silver lining, right?
That's right.
In all of these things. Thanks again, Kristin, for showcasing your work and the work of the Shaw Center for Children and Families here at Notre Dame. And for our colleagues and future collaborators on the call, just know that all of these things that you've heard about today from Notre Dame and other places, we're all just looking to expand our reach and work together and find ways that we can collaborate on these important matters across the state. So thank you very much.